Most falls don't happen doing something heroic. They happen at home. On a normal day, during a normal movement you've done 10,000 times, a small turn in the hallway, a step toward the kitchen, a quick trip to the bathroom at night. And here's what many people miss. Sometimes it's not the floor that changed. It's your reaction time, your balance system, your blood pressure control. Today, we're going to talk about medication patterns that clinicians watch closely in adults over 70, because certain prescriptions and even common over the counter products can quietly increase fall risk. This is not a fear video, this is a precision video, and we will cover exactly what to ask your doctor or pharmacist without stopping anything on your own. Falls are not just part of aging. They're common, yes, but they are not random. In the United States, over 14 million older adults report a fall each year. That's about 1 in 4 adults age 65 and older. Public health fall prevention programs repeatedly point to one major fixable factor: medication review. Not because medications are bad, but because side effects can change how your body handles standing, turning, and reacting. 2 rules before we begin. Rule 1: do not stop, taper, or experiment with your medications because of a video. Rule 2: use this video to start a smart conversation with your clinician or pharmacist. The goal is not panic, the goal is precision. If you've had a recent fall, near fall, or sudden dizziness after a medication change, that is a reason to talk to a professional sooner, not later. Clinicians often use a simple concept called FRIDs, fall risk increasing drugs. It's not one magic villain, it's a pattern. A medication can increase fall risk by causing sleepiness or slower reaction time, dizziness or unsteadiness, confusion or blurred focus, or sudden blood pressure drop when you stand. And here's the multiplier: risk can stack when multiple brain active medications are combined. So this video is about patterns, not blame. Before we name categories, do this quick check. 1. When is your riskiest time? Is it right after you stand up in the morning? Is it at night when you're half asleep, walking to the bathroom? Did the wobble start after a new prescription, a dose increase, or adding an over the counter product? If any of that is true, you are exactly the person who benefits from a targeted medication review. Now, let's get specific. The most consistent fall risk signals come from medications that depress the central nervous system. That includes benzodiazepines and the so-called Z drugs used for sleep. Geriatric prescribing guidance flags these because of risks like sedation, cognitive impairment, and increased falls and fractures in older adults. Systematic evidence also links these medication groups with increased fall risk. Important nuance: this does not mean you shouldn't need them. It means the benefit must clearly outweigh the fall risk, and the plan should be reviewed regularly. Ask your doctor, is this still necessary? Is there a safer alternative for sleep or anxiety? If we reduce it, what taper plan is safe? Antidepressants can be life-changing. Many people truly need them. But some antidepressant classes have been associated with increased falls in older adults in systematic research. And geriatric guidance raises fall and fracture caution in certain scenarios, especially if there's a history of falls. This is not never use, this is monitor carefully. Watch for new dizziness, new sedation, slowed reactions, or feeling unsteady. Ask, could this be contributing to my unsteadiness? If it's essential, can we adjust timing or dose? Is there a way to reduce daytime grogginess? Antipsychotics show up repeatedly in fall risk evidence. They are consistently associated with higher fall risk in older adults. If someone is prescribed one, the conversation should be proactive. Dose review, regular reassessment, and a parallel fall prevention plan. Ask, what is the ongoing goal of this medication? What would trigger a dose reduction or a stop plan? What fall prevention steps should we add while I'm on it? Pain itself increases fall risk because pain changes how you walk and how you react. But some pain medications can add sedation, dizziness, or delayed reflexes, and certain nerve pain or anti seizure drugs used for pain are part of fall risk discussions in older adults. Again, not never, but get specific. Ask, is my pain plan the safest option for balance and alertness? Can we reduce nighttime grogginess? Can we pair pain treatment with strength and balance work so I need less medication over time? This one is sneaky because it often includes over the counter products. Anticholinergic burden can contribute to confusion, delirium, and increased falls and fractures, especially when multiple anticholinergic medications are combined. Translation: if you're stacking several drying medications, sleep aids, allergy products, bladder urgency meds, your clarity and balance can take a hit. Ask, do any of my medications have anticholinergic effects? Can we reduce the total anticholinergic load? Is there a safer alternative for the symptom I'm treating? If you feel dizzy when you stand, fall risk can spike because your blood pressure may lag behind your movement. Medication review frameworks for fall prevention specifically include assessing medications that can contribute to falls and intervening when needed. This is especially important if you recently changed blood pressure meds, you were sick, you're dehydrated, or you lost weight, and your old dose may now be too strong. Ask, could any of my medications be lowering my pressure too much when I stand? Can we check my blood pressure lying, sitting, and standing? Should we adjust timing to reduce nighttime or morning dizziness? Even if each medication makes sense on its own, combinations can amplify side effects. The Beers criteria highlights increased fall and fracture risk with CNS active drugs and cautions about combinations, especially when multiple CNS active medications are used together. This is where a pharmacist can be your secret weapon. They're trained to spot interaction patterns quickly, and CDC fall prevention resources include pharmacist supported approaches like Steady RX. Here's the smartest move you can make: bring every prescription, over the counter product, and supplement to one appointment. This is often called a brown bag review. Then ask these questions exactly like this. 1. Which of these could affect balance, alertness, or standing steadiness? 2. Do any of these increase fall risk more in older adults? 3. Do I have duplicates? Same effect, different product. 4. Can any doses be reduced safely? 5. Can we adjust timing, especially nighttime dosing, to reduce grogginess? 6. If we stop something, what is the safe taper plan? 7. Should we check blood pressure lying, sitting, and standing? 8. Which single medication change would reduce fall risk the most with the least downside? 9. Can you refer me to a pharmacist led medication review or a falls program? That's not confrontational. That's responsible. While you're working through medication review, do these three tonight. 1. Add a nightlight path to the bathroom. 2. Remove or secure loose rugs and cords. 3. Wear stable footwear at home. Prevention is not one big change, it's a dozen small ones done consistently. If this gave you a real plan instead of vague comfort, subscribe to Sage Counsel. We publish evidence checked guidance designed specifically for adults 65 and older. And I want one quick comment from you. Do you spend time alone during the day? Comment, alone or not alone, because the next videos will be prioritized for the people most at risk. And the truth is simple: the best advice in the world is useless if it arrives 5 minutes too late.